Hey guys, welcome back to my channel. If you're new here, hit that subscribe button, and if you're returning, you must be wondering why I'm doing a voiceover in the middle of my intro. So I don't have a official intro for this video. However, it's a day in my life as a dental student, new semester, so we're doing new things. So guys, for this aspect of my course, we are now seeing patients for examination, and the procedure for this, basically when I say examination, what I mean, we're doing intraoral as well as extraoral examination of the patient, and in today's video you'll get to see how an extraoral examination is performed. So before the patient comes in, you have to ensure that you clean the chairs, clean all the equipment that you'll be using, and what I'm using to clean the chair is a cavicide and a gauze. So for me, I dispose of the gauze after cleaning each section of the chair. You just want to go through and you want to clean all the areas that you know you're going to be touching and stuff like that, because you don't want to have any cross contamination. You want to limit that as much as possible. So guys, here I'm heading to the dispensary, and of course I don't know how to act in public. I rarely ever vlog in public, so I'm still getting used to it. And here, this is my cousin, my patient, my very first patient outside of my classmates, and I was just trying to get him to do a thumbnail, like, oh my god. But yeah, I was just heading to the dispensary to see if my instruments were done, because you have to get them autoclaved before using them in the patient's mouth. So when I went there, they said that they'd be ready in about 10 minutes, so I had to wait for them and stuff like that. So in the meantime, I was just asking for my PPE gears for when you're seeing patients. So you have to have on your buff on cap. The school substitute that for a hairnet. You have to have the, I don't even know if it's a surgical lab coat. I think that's what it's called. You have your gloves and you have your face shield, and of course your face mask. So yeah, there I am again, don't know how to act. So yeah. So guys, there I have my little stereo pouch with my sterilized instruments. So ready to see my patient. So we're back in the pod where we see the clinic area, where we see our patient. So there I'm just allowing him to have a seat and put on his goggles. You have to give the patient protective eyewear. And then I was putting on my PPE gears. So guys, when doing this or anything at all in dentistry, it's a team effort. So one of my classmates helped me to tie up my lab coat and stuff like that. So yeah, that's just what we're doing, getting ready to see our patients. So guys, after finishing this, I'll head to get my tray. There I am with my tray coming back. It has my gloves, and now I'm opening the stereo pouch, and I opened this before putting on my gloves because a lot of hands touched the outside of that package, so you want to open it prior to putting on your gloves, otherwise you'll have to change it. So put on your gloves afterwards. Basically what you'll be needing to do the examination is your basic setup, which includes your probe and explorer, your mouth mirror, your cotton pliers, air water syringe, gauze, cotton roll. You have the bib for the patient on the tray, and you also have a suction tip. So there, I'm getting my patient ready. So I'm just positioning him in the chair that's comfortable to me, and of course you have to ensure that a patient is comfortable as well. So before we get started in the procedure, you want to break the ice, because a lot of time patients tend to be nervous when coming to the dentist, so you want to have casual conversations with them just to lighten the air and get them a little bit more relaxed prior to going in the procedure. So that's just what I'm doing. To start the extraoral examination, what you need to observe first is the ankles. So now I was just asking him to pull up his pants so I could see his ankles. So you're checking to ensure that they are not swollen, because if they're swollen, it's indicative of renal or hepatic disease. You then want to check the nail bed to see if they blanch on pressure, and that will indicate whether or not the patient has good circulation. Afterwards, you are going to head to the scalp of the patient, and you just want to check to see if there's anything abnormal going on. You check the symmetry of the face, and then you're going to ask the patient to follow your fingers just to see if their eye coordination is good. A lot of dentists, they skip the extraoral examination aspect. I've never ever gotten an extraoral examination, and I've been to all classes of dental offices, and I've never gotten an extraoral exam, which is bad. After which, you want to locate the junction of the sternum and the clavicle, and that's where the sternocleidomastoid originates. And you're just checking for your cervical lymph nodes. Typically, if they're normal, you won't feel anything. After reaching the mastoid process, which is where the sternocleidomastoid muscle inserts, you're going to walk back to the occipital notch to feel for the occipital lymph nodes. Then you want to go post-auricular and then pre-auricular. You then want to check the air. You want to check to see if there are any piercings, make note if any, and you also want to check to see if there's anything growing out of the patient's ear. So there you're going back on the opposite side, and you're doing the same thing. So locate the junction of the sternum and the clavicle. Then you want to see if any of your cervical lymph nodes are swollen. Straight back up to the mastoid process. Then you walk back to your occipital lymph nodes. You come back and you go to your post-auricular lymph nodes. Then you check the pinna of the ear again. And again, you would make note if there are any piercings or any abnormalities, any lesions, and so forth. Okay guys, so now I'm going to be checking his TMJ. So you want to put your fingers at the triggers of the ear, and you want to ask your patient to open wide. Now if you guys look closely, you will realize that there is a deviation to the patient's left. So you have to make note of that when you're writing up your treatment plan. So there I'm just confirming to ensure that I make note of the deviation correctly. See, I'm saying that it's on the left. So afterwards, you're going to be checking the parotid gland, and you want to go up under the angle of the mandible to check for the tail of the parotid gland. After which, you're going to be palpating the submental and submandibular gland, and once again, you should not feel anything unless something is wrong. And there, I'm just checking the mentalis muscle. Okay guys, so this is the last step of your extraoral examination, and you just want to sweep the midline of the neck, and you also want to ask your patient to swallow at this point to make note of any deviation or any swelling that may be present. So guys, that's the end of this week's video. I hope you liked it. Don't forget to subscribe to my channel if you haven't. Like this video and share with many friends. See you in my next upload. Bye.